Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about hyperthyroidism. In particular, I will cover what it is, how you treat it, and how you can better live with hyperthyroidism. So we start with, what is it? Thyroxine is a body chemical or a hormone made by the thyroid gland. It is carried around the body in the bloodstream. It helps to keep the body's functions, the metabolism, working at the correct pace. Many cells and tissues in the body need thyroxine to keep them going correctly. So hyperthyroidism means an overactive thyroid gland. When the thyroid gland is overactive, it makes too much thyroxine. The extra thyroxine causes many of the body's functions to speed up. Thyrotoxicosis is a term that may be used by doctors instead of hyperthyroidism. The two terms mean much the same. Although hyperthyroidism can be serious, if you ignore it, most people respond well once hyperthyroidism is diagnosed and treated. So the symptoms would be being restless, nervous, emotional, irritable, sleeping poorly, and always on the go. Tremor of the hands, losing weight despite an increased appetite, palpitations, sweating, a dislike of heat, and increased thirst, diarrhea or needing to go to the toilet to pass feces more often than normal, shortness of breath, skin problems such as hair thinning and itch, and menstrual changes, often during periods becoming too light or infrequent. Tiredness and muscle weakness may be also a feature. A swelling in the thyroid gland in the neck or a goiter may occur, and eye problems if you have Graves' disease. So most people with hyperthyroidism do not have all the symptoms, but a combination of two or more is common. Symptoms usually develop slowly over several weeks. All the symptoms can be caused by other problems, and so the diagnosis may not be obvious at first. Symptoms may be mild to start with, but become worse as the level of thyroxine in the blood gradually rises. There are various causes which include the following. Graves' disease. So Graves' disease is the commonest cause. It can occur at any age, but it's most common in women aged 20 to 40. It can affect anyone, but there is often a family history of the condition. Graves' disease is an autoimmune disease. So the immune system attacks tissue in the body, in this case the thyroid. This stimulates the thyroid to make lots of thyroxine. It is thought that something triggers the immune system to make these antibodies, then the trigger is not known. In Graves' disease, the thyroid gland usually enlarges, which causes a swelling in the neck or a goiter. The eyes are also affected in about half the cases. If they are affected, the eyes are pushed forward and look more prominent. Also, thyroid nodules. So this is a less common cause of hyperthyroidism. Thyroid nodules are lumps which can develop in the thyroid gland. It is not clear why they develop. They are usually benign, which is non-cancerous, but contain abnormal thyroid tissue. So other causes. There are several other rare causes of hyperthyroidism. For example, some people who take the medicines amiodarone and lithium develop hyperthyroidism. There are various other rare diseases that result in excess thyroxine being made. So next is, how do you treat hyperthyroidism? The main aim of treatment is to reduce the level of thyroxine to normal. Other problems such as large goiter or associated eye problems may also need treatment. Factors such as the underlying cause of the problem, your age, and the size of the goiter are taken into account to decide on the best treatment plan. And treatment options include the following. So medicines. The medicines can reduce the amount of thyroxine made by the overactive thyroid gland. The most common medicine used is neomercazole. So neomercazole does not affect thyroxine, which is already made and stored, but reduces further production. Therefore, it may take 4 to 8 weeks of treatment for your thyroxine level to come down to normal. Next would be polyurethuracil. Can be used in patients with sensitivity reactions to neomercazole, and radioiodine. This involves taking a drink or swallowing a capsule which contains radioactive iodine. The main issue of use of iodine in the body is to make thyroxine. Therefore, the radioactive iodine builds up in the thyroid gland, As the radioactivity is concentrated in the thyroid gland, it destroys some thyroid tissue, which reduces the amount of thyroxine that you make. Also, there's thyroid replacement therapy. It can be difficult for a doctor to judge just the right dose of neomercazole or just the right amount of radioiodine to give in each case. Too much treatment can make the thyroxine level go too low. Not enough treatment means the level remains higher than normal. So surgery is an option. This involves removing part of the thyroid gland. It may be a good option if you have a large goiter. And finally, how do you live with hyperthyroidism? There are really two stages to coping with Graves' disease and hyperthyroidism. The first is dealing with the condition at its active stage, when the thyroid is overactive. The second is the time after treatment, when most patients become hyperthyroid, after the thyroid has been radioactively ablated or surgically removed. After ablation or removal of the thyroid gland, most patients do become permanently hyperthyroid and require lifelong thyroid hormone treatment. Some patients still describe themselves as hyperthyroid or as having Graves' disease, but that is not true, because in reality, after surgery, most people become hyperthyroid. An important issue for any post-surgery patient is the proper treatment and management of their hyperthyroidism with thyroid hormone replacement drugs like Thyroxine. And finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist in managing hyperthyroidism more effectively on a day-to-day basis. To start with, we have numerous products to get you started on an exercise program, such as exercise ball, floor mats, weights, and various other items to kickstart you in a program that we create together and is tailored specifically to you. We also have various supplements and products which you can purchase from us without prescription, such as vitamin D, calcium, dietary supplements, anti-inflammatory creams for swollen skin, and lubricating eye drops. We also have light boxes to promote relaxation, blood pressure monitors, blood sugar monitors, and body fat monitors and assisted living devices. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of hyperthyroidism. During a telehealth clinic together, we create a cohesive management plan which enables you to take a more active role in managing hyperthyroidism with confidence. We provide you with the tools you need to live a healthy life. Call into Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.